Hi, I'm Dr. Matthews. I'm here today to talk to you about body composition assessment, and we're going to be talking about this from the perspective of health and sort of working with the general public, personal training, that sort of thing. So a couple good sources of information on this are the American College of Sports Medicine's ACSM resources for the exercise physiologist, and I'm looking at specifically talking about the second edition, chapter 7, and also the ACSM's exercise testing prescription guidelines textbook. That's edition 10 and chapter 4. So if you scan one of these two barcodes here, you'll be able to see which books I'm talking about. There's going to be some things in this that you're going to, some items that we're going to be talking about, but you're probably going to want to open those books and look through them and get to the table or figure that I'm talking about, and you'll be able to understand what it is I'm saying. So I'm not going to go through this entire list here. I'll go ahead and pause the video and read through the list if you want to read the entire sequence of exercise prescription tasks that I'm suggesting that you do before working with the client or while working with the client. But specifically, we're going to be talking about this section here that's in red, the weighing them, the getting the height, getting the body composition, which is important when it comes to talking about the health of the individual. No uniform standards for body composition exist. So if you look in different textbooks, or even within the same textbook from the same organization at different points of that textbook, you're going to see body fat standards that are different. All right, there's a lot of similarities there. It's not like some people are telling you it's okay to have a body fat of 50%, others are saying it has to be 2%. There's a lot of overlap between the recommendations, but the recommendations do vary a lot depending on the source, and again, even within a source. So for instance, if you look at the ACSM's recommendations for health, all right, this is for health, not for sports performance or for aesthetic appearance or anything like that. 10 to 22% is the recommendation for men, 20 to 32% is the recommendation for women, with a minimum body fat percentage of 10 to 13% for women and 3% for men. All right, so when I say minimum body fat percentage, I'm talking about a term called essential fat. So essential fat is the fat that you need in your body, and if you don't have it, you're going to start having some sort of issues. All right, so your physiological systems aren't going to work properly, or you might run into illnesses, or if it gets low enough, potentially death. So we all need a certain level of fat in our body, and this is actually pretty low. If you see some recommendations for essential fat, it'll actually be a little bit higher than this, especially for women. They start losing their menstruation oftentimes well above this level of fat. All right, so again, though, these recommendations for fat here, the 10 to 22 for men, 20 to 32% for women, it's going to vary depending on the source you look at. And even within the ACSM textbooks that I'm primarily looking at for this course, it is going to vary quite a bit. So I'm looking right now at tables 4.4 and 4.5 in the ACSM guidelines textbooks. So you can look at the QR code here in order to see which textbook it is I'm talking about. But basically what we're looking at here is the body fat percentages, so percentile ranks of different categories based on the age of the individual and the sex of the individual. And you'll notice that these percentages don't quite line up, well, not the percentages, but the categorical ranks, so that where it says good, fair, poor, don't quite line up with the values that were on the previous slide. So if we go back for a second, let's say for the men, 10 to 22% was the recommended range for health, 10 to 22%. If you're looking at young men, so 20 to 29 age group, let's see, that's going to put you somewhere between excellent and poor. So it's a really wide range, right? So again, the categories don't quite line up depending on which source you're looking at. So make sure you know what the source is that you're looking at and what it's actually telling you. So these tables, again, tables 4.4 and 4.5 in the ACSM testing prescriptions guidelines textbook, those are really more to rank you according to others of your same age, right? So a lower body fat percentage is generally thought of as better. Higher body fat percentage is generally thought as worse, but the extremes on both sides. So if you're too lean or too big, too much body fat, that is a bad thing for your health. A person with a really high body fat percentage is said to have obesity. All right, so a person with obesity is going to be a greater risk for a lot of diseases that are very bad that you want to try to avoid, things like hypertension, type 2 diabetes, coronary heart disease, stroke, and the list goes on, and the list is actually much longer than what you see here. This is a very abbreviated version of the list. And unfortunately, in the United States, as well as in most modern societies around the world, we are in an obesity epidemic. So if you look here at this map, this is a map of the United States, and each state is color-coded for the percentage of the state that has obesity. All right, so this is based on BMI, and it's done by the Center for Disease Control of the United States. So it is pretty good information here. And you can see, though, that the vast majority of the country has at least 30% body fat. This is this orangish color here. Some states have even higher than that. So again, we do have an obesity epidemic here. If you want to see a little bit more about this obesity epidemic, I have some links here to the rest of the map. So this is just the 2015 map, but there are several maps. This has been going on. They do this every year, and they have been doing it every year for a couple decades or so now. You can also scan these QR codes here. I clicked on this link, and it's going to take you to a video that I've made that just cycles through those maps so you can see them all in one sort of easy to consume place. So feel free to look at that. But point is, the United States has gotten much, much worse over the years. So we used to have much lower rates of obesity than what we have now, and it's getting worse, and it's been getting progressively worse for several decades, and it is an epidemic. Obesity was the high end of the spectrum. On the other end of the spectrum, people who are ultra lean to the point of disorders, oftentimes those people are going to have an eating disorder. And just to be clear here, you can have an eating disorder without actually being ultra lean. So an eating disorder is bad no matter if you're ultra lean or not. But the main eating disorders that I want to talk about are anorexia nervosa and bulimia nervosa. These are the two most commonly talked about eating disorders. With anorexia nervosa, this is basically a refusal to maintain a normal body weight. All right, so you have this sort of fear of fatness, and you essentially do a self-starvation type diet. And so you have a very distorted body image. You think you're fatter than you are. You see every little crease, every little lump, whatever it is, and you think it's body fat, and you're super afraid of it. And it's again, it's a psychological disorder. And because both of these, actually all eating disorders are psychological disorders, which means they're outside of our scope of practice, but you still need to know about them because you still need to try to identify some of the red flags of them. And I have a lot of those warning signs here in this table. And if you think somebody has an eating disorder, you need to try to get them help. So you are not qualified to give them help as an exercise professional, but you are qualified to help the people, the psychologists, and whoever else is dealing with it to identify individuals who might need help and then to refer them to those qualified people. All right, so again, anorexia nervosa is a severe caloric restriction through not eating. All right, bulimia nervosa is very similar, and a lot of times these go hand in hand. People have a little bit of both. The difference between bulimia and anorexia is with bulimia, they'll usually eat. Sometimes they'll even excessively eat, but then they'll do some sort of binging or some sort of purging behavior. So you'll hear people talking about binging and purging. Binging is eating way too much. Purging is then trying to get rid of it. The sort of stereotype of this is vomiting. So people who binge eat, they eat a lot of food, and then they go and they vomit it all up to try to get it out of their body so they don't gain the weight. Laxatives is another form of this. So you take laxatives so that you excrete all the food that way. People also sometimes will abuse diuretics who have this disorder, which won't get rid of the calories necessarily. It'll get rid of a lot of water though, which will give them a leaner look, so that it kind of perpetuates this sort of disorder, this idea that they should be super thin and super lean. And there's also excessive exercise as a form of purging. So all of these are a form of purging where you are essentially trying to get rid of what's inside your body, and at an excessive level where it's unhealthy. All right, so again, anorexia nervosa and bulimia nervosa, a lot of overlap between the symptoms, the red flags. The main difference is with anorexia, you're just restricting your diet too much. With bulimia nervosa, you can be restricting your diet too, but you're also doing some sort of purging behavior to try to get rid of what you've taken in. Both of these are going to cause decreases in mood, fertility, inability to regulate your body temperature properly, and they're going to have horrible effects on bone density. So you might not notice it right away, but when you get older, or when your client who may have an eating disorder gets older, they're going to have issues with their bones. So they're going to have very poor bone health, osteoporosis, osteopenia, easy bone breaks, and it's going to be related to what they did when they were younger. All right, your bones that you're setting up as you're young are going to affect your bone health when you're old. So it's very important to make sure that you're not affecting your bone health when you're young. So eating disorders can also increase cardiovascular risk. So this is where it gets to be deadly, as they can cause all kinds of issues, some of which mess up your electrolytes. And if your electrolytes in your blood and your tissues get messed up, your heart and your skeletal muscles, all the muscles of your body function through changes in electrolyte gradients. And so it can cause contraction when you don't want contraction, or things to not contract when you do want them to contract. And if that's the heart that's happening, it can cause cardiac arrest. And so that's a way a lot of people with eating disorders actually die, is through cardiac arrest or some sort of heart attack or something. Again, here's your list of things to look out for. I'm not going to really read through this list in its entirety, but extreme weight loss is a fairly obvious one. Excessively exercising, constantly having sort of this preoccupation with food and looking thin and looking at yourself all the time, being very fatigued, absence of menstruation for women, eroded teeth if you're vomiting, right? That comes from the bulimia side of things. But again, you can read these. A lot of them have similar signs to like a depression, because again, this is a psychological disorder, which is why it's outside of our scope of practice. Let's talk about body mass index, or BMI, for a little bit. So BMI was what was used to create those maps that the CDC puts out. And you'll hear a lot of people talking in a very negative way about BMI, but BMI is actually a very helpful tool, and for most people it's actually pretty accurate as well. All right, so BMI is nothing more than essentially a height and weight scale. It is your body weight in kilograms divided by your height in meters squared. All right, so you square your height in meters and use that to divide into kilograms. The BMI classification system is used to determine if someone is underweight, normal weight, overweight, or obese, or various classifications of obese based on the number. So under 18.5 is underweight, normal weight is 18.5 to 24.9. Overweight starts at 25, goes to 29.9, and obesity starts at 30 in the various classes beyond that. All right, so with this, the big numbers you probably need to try to remember are 25, that starts overweight, and 30, that starts obesity. All right, so most people who have issues with weight, it's not being underweight, it's not being too lean. Of course, there are some people who have this issue. We just talked about eating disorders, and those people often are going to be underweight. But the vast majority of Americans, again, we're in an obesity epidemic. Most people are going to have issues on this end of the scale, so being overweight and obese. So again, 25 and 30 are good numbers on the BMI scale to try to remember. If you want some help with how to use basic sort of office scales, like a medical office scale for height and weight, here are some QR codes and some links that you can go to in order to watch a video on how to do that. Let's talk about the downfalls of this. So again, this is just a height-weight ratio, essentially. And so people who are very muscular, or a lot of people in our field, in the exercise sciences, who are very muscular, who work out all the time, they're going to have more muscle than the average individual, and they're probably going to be also leaner than the average individual. But because they have so much body mass and muscle mass, they're going to look on a height-weight ratio type scale like this as being on the overweight, maybe even obese side of things. Especially if you start looking at like the big bodybuilders, they're all going to look like they're obese, even though they're clearly very lean. That's one of the downfalls of BMI. The other sort of side of the downfalls is a person who has almost no muscle mass whatsoever, but has a fair amount of fat mass. As long as it's not a crazy amount of fat mass, they can actually look normal weight, even though they are over fat. All right, so it's not the body mass that's so important. Again, it's the percentage of your body mass that's fat, and BMI is just a rough index of if you have too much body fat, essentially. So it doesn't actually measure body fat, it's a height weight index. If somebody doesn't have a lot of muscle but has a lot of fat, their weight, muscle weighs more than fat, remember that, so their weight can end up looking like their normal weight even though they're not. They're actually over fat. So those are the two major sort of cons to using BMI. Again, though, most people don't fit into one of these two categories. Most people are going to have a normal amount of muscle. They're not going to be over-muscled, looking more obese, or under-muscled and looking like they're lean when they're not lean. They're going to have somewhere in the middle, right? And so for most people who are regularly active or sedentary, which is the vast majority of the population, BMI is actually a really good classification system. So even though a lot of people, especially people in our field, the exercise sciences, tend to talk about BMI in a very negative light, for the vast majority of people, BMI actually is going to categorize them just fine. So it's actually a really helpful tool, and you probably should know the nuance and not just call it this terrible thing that you shouldn't use. BMI is very useful and it should be used for most people. Another very easy to use method for assessing cardiovascular risk. That's really what we're talking about. We're talking about cardiovascular risk when we're talking about having too much body fat. So if you have a greater waist circumference than what you should, that suggests that your risk level is higher. So for men, that's greater than or equal to 102 centimeters or 40 inches. For women, 88 centimeters or 35 inches. All right, so if your waist is bigger than that, and you can go down here and watch this video, scan this QR code, or click the link in order to get to those videos, you're going to see how you can actually measure this on somebody. And you can also calculate what's called a waist-hip ratio. So a waist-hip ratio looks at how big your waist is versus your hip, and it puts it into this format, in a ratio format. And so if a young male has a waist-hip ratio equal to or greater than 0.95. If a young female equal to or greater than 0.86, they are at a greater risk for cardiovascular events, so heart attack, stroke, those sorts of things. If you're older, 60 to 69, we allow sort of a greater level here. So 1.03 for men, 0.9 for women. The issue with having a large waist or a high waist to hip ratio is it means you're carrying more of your body fat in your central region, so you might have android obesity. The reason why android obesity, which is what's depicted here, it's this apple shape, is worse than gynoid obesity, which is more this pear shape here, is because it's putting all the fat around your major organs of your body. So it's infiltrating into your heart, into your digestive tract, and it can potentially cause all kinds of issues. So fat that's in your hips, like gynoid obesity, is going to be much less impactful on your health than fat that's in your abdomen and torso, like android obesity. So if somebody has this sort of apple shape to them, they are at a greater risk of cardiovascular events than somebody who has a sort of pear shape to them. Typically, when men get obesity, they're going to have an android shape. When women get obesity, they're going to have the gynoid shape, but that's not everybody. There are men who have a gynoid shape, and there are women who have an android shape to their obesity. So let's talk about some of the methods for actually assessing body fat composition. So up until now, everything we've talked about hasn't really assessed body fat. It's been an anthropometric measurement. So that means just measuring the body, the circumference of the body, the height of the body, the weight of the body. Now we're actually talking about body composition measurements, where we're going to be getting a percentage of the body that's fat. I have these stars here next to the ones that are considered the gold standard, or once were considered the gold standard. There's a lot of methods out there. I'm only hitting on 5 of them here, but there are so many more than what I'm mentioning here. But the best ones are going to be dual energy X-ray absorptiometry, or DEXA, which is the same method that's used to test bone density. Another method that's also a current gold standard, so would have 2 stars here if it was on this list, would be MRI. They're super expensive machines that are basically just going to be in medical facilities. Going down the list here, hydrostatic weighing or underwater weighing was once the gold standard, and it was for several decades. Air displacement plethysmography, which is the bod, is probably on par with hydrostatic weighing. They're both still kind of gold standards, but they're a little dated at this point. but they do still do a good job though. Coming down to more of a applied sort of fitness center type measurements, Skinfold, thickness, and biological impedance analysis, or BIA, are pretty good sort of user-friendly fitness center style measurements, where these are more things that would happen in like a laboratory setting. All right, so a lot of these are going to calculate body density and not body fat directly. So if you get body density though, you can just put it into one of these body fat percentage calculations. This is the Siri equation in order to calculate body fat percentage. So again, a lot of these you're going to have to do a lot of math, and you'll get body density and eventually body fat from them. So let's go ahead and talk about these one by one. Pros to DEXA is it gets both the soft tissues, so you can quantify body fat percentage, and it's really, really accurate at doing that. You can also look at things like bone density, which is really what it was designed for. So it's got a couple uses for it. It's also, like I said, very precise. It's highly reliable. You can see what it looks like here. This is an image from the University of Scranton, sent to me by Dr. Paul Cutrfellow. And so basically you lay on this table, and this arm goes over your body and makes this scan of your body. And from that, you can see the hard tissues, the bone, and the soft tissues, which includes body fat and lean tissues as well. All right, so the cons to DEXA are, again, it is a gold standard, a current gold standard, so it's really good at what it does, but the cons are it's very expensive. So at the very cheap end, these machines are probably going to cost somewhere in the $30,000 to $40,000 range, but you can get them well over $100,000. For more sophisticated machines. Another major con to them, and probably the biggest con, is that they do give a low dose of radiation. So it is an X-ray based method. All right, so X-rays, just like X-rays that you get if you broke a bone, it gives you a low dose of radiation. This is a much lower dose than a typical X-ray for a broken bone. In fact, if you talk to the companies that make these, most of them will say that the amount of radiation put out is so low and so minuscule that it really shouldn't be thought of as such a big deal. Unfortunately, the regulations change state by state in the United States. So in a state like New Jersey, where I live, this is highly regulated. It's very difficult to use a DEXA machine because of how much regulation there is. If I go over to Pennsylvania, I could go to the University of Scranton where this picture was taken. I could learn how to use this machine probably 5 to 10 minutes. And I can be testing people right after that without any specialized training, because the radiation is so low. It's really not that big of a deal, according at least to the people who know a lot about this. I'm not going to pretend to be an expert on this, but I know a little bit. So if you talk, actually I talked to a company that makes these recently. They said the amount of radiation their machine puts out is equivalent to eating like 4 or 5 bananas, because the potassium in bananas is technically radioactive. So we're not talking about a ton of radiation, but again, some states are going to regulate this probably more than they should. All right, so hydrostatic weighing or underwater weighing, again, this is the old gold standard that everything used to be compared to. It's still pretty good, but it's much more challenging to do well than the other gold standards I'm going to talk about here. So with this, you're going to have to weigh the person on land. You're going to have to assess their lung volume, because the lungs are going to make them float, which makes them look less heavy underwater, which is the next step, which is where you're going to actually weigh them under the water. So basically the person goes into this giant water tank, they sit on this scale, they dunk their entire body under, and they blow out all the air so they have as little air in their lungs as possible. And then from that, after that you weigh them, and that is their underwater weight. And then there's a lot of calculations that go into assessing the body fat percentage. If you want to see more on the methods of this, here's a video. You can scan the QR code again, or go to this link here. The good thing, again, very good measurement if it's done properly. There is some skill to it, though. And the bad side of this, though, is it's confounded by lung volume, which is why we have to measure lung volume. But we measure lung volume to then basically estimate residual volume, so the air that's going to be trapped in your lungs even after you blow out all the air you can. All right, so that's going to, because it's an estimate in most cases, it's going to cause a little error to the signal if somebody has a little more, a little less than what you estimated. Also, conversion of body fat to body density to body fat is necessary here. And for some people, the body density or body fat densities are going to vary more than what we typically think they should, or what we account for in our equations. And so that can also throw a little error into this. Some other notes here, again, you're going underwater, so you're probably going to have to wear a bathing suit like you can see there. And for some people, that makes them very uncomfortable. You're also in a small space, blowing out all your air underwater. So for some people, this is kind of an anxiety-ridden test. So for a lot of people, this probably isn't the best test for them. Again, all these tests have pros and cons to them. All right, so the next one here, air displacement plethysmography, or the only version of this that I am aware of is the BOD-POD, which is the commercial name for this unit here. This uses very similar basically physics as the underwater weighing. So in underwater weighing, you displaced water, and then we measured your underwater weight in order to essentially get an idea of how much buoyancy and water displacement you did. Here you're displacing air, and then the calculation is very similar, but it's all done in the background in the computer system that comes with the BOD-POD. All right, so fairly easy to use. Definitely, I would say easier to use than the underwater weighing. The person doesn't have to get wet, which is nice. They do have to go into this small egg-shaped sort of chamber here. So for somebody who's a little claustrophobic, it can be a little bit of an anxiety-ridden experience too. Good news is there's this window that helps a little bit. There's also a little emergency button on the bottom of the seats that they can push that opens the door, so they can always control the situation and get out if they need to. Some other cons to the BOD-POD is any sort of air movement, any movement around the machine is going to cause the air pressure to vary just enough to cause errors here. So you need, in basically a very small room where there's minimal air movement, minimal people moving around. The person in the tank can't be, or in the pod can't be moving their hands or doing anything. You also need to compress the hair on the body, so that's why he's wearing this swim cap here. If he had a hairy chest, we'd also have to shave his chest. Also, he's not wearing big baggy clothes. That's why he doesn't have a shirt on. He has basically compression shorts on, and that's it. So people have to go into this tube wearing minimal clothing, and the clothing that they wear has to compress onto their body. All right. And the reason for this is if you have any trapped air, whether it's trapped by your clothing or trapped by your hair, that air is going to warm up quickly, and once it warms up, that air is actually going to compress easier, which is going to affect the measurement when it starts to try to look for pressures of air inside the chamber. So it's going to make it look like you're leaner than you actually are. All right, so here's another link and a QR code if you want to see a test run here. All right, so on to the more field type tests. So these are the ones you're going to see in most fitness centers. So we have Skinfolds and we have biological impedance analysis, or BIA. All right, so Skinfolds, basically you go around, you pinch the skin, you grab it with one hand, you put these calipers on the skin, and you get an idea of the body fat percentage from that. And so when doing this, so you're going to do this on several parts of the body, there's a lot of skill involved. All right, there's a lot of skill, which means there's a lot of room for error. There's a lot of human error to this measurement. If you're good at it, you can be pretty accurate with it. All right, so the accuracy can be plus or minus 3.5% basically. When it's 3.5%, you're talking, if you get a 10% body fat on somebody, they're really somewhere between 6.5% body fat and 13.5% body fat. So it's not a lot of range. It is a decent measurement considering how low tech it is. It's also fairly cheap. I didn't mention it on the BOD-POD before, but BOD-PODs are over $50,000. So it's a lot of money. Hydrostatic weighing, you can set up a tank fairly cheap if you have a pool, if you have access to a pool, but it can also get expensive if you are trying to do a really sophisticated tank. The Skinfolds, you're looking at probably $150 to $300 for a good pair of calipers like what you're seeing in this picture. You can get the calipers cheaper, but the quality goes down a little bit. You need a minimum of 3 sites, so you have to pinch a minimum of 3 places on the body, but it can go up to 7 in most equations, and I prefer the higher number, the 7-site equations, just because you get a better idea of the whole body in case somebody carries their weight more in one place than another. There are equations that go beyond 7 sites, but they're pretty rare. Most people don't use them. Downsides this, again, highly skill oriented. So if you're not really skilled in it, you're going to get really bad numbers. And also it makes people uncomfortable. They're going to have to remove clothing. You're going to have to pinch and touch their skin directly. So it makes people uncomfortable. And the accuracy is good, but not as good as the gold standards. All right, so on to BIA, or bioelectrical impedance analysis. Almost as good as Skinfold. So you can see the standard error of the estimate here is 2.7 to 6.3, depending on the source you look at. So it can be a little bit better, a little bit worse than Skinfold, but it's probably on par most of the time. And so what you do with bioelectrical impedance analysis is you put an electrical signal into the body and you sense it in another location. So here, this is a foot-to-foot model. So the electricity goes in one foot, comes out the other, and is sensed. And so we are able to determine how much impedance there was to electricity going through the body, and that's what's basically used into regression formulas with some other information like your height, your weight, your gender, your athletic status, and it gives you an idea of your body fat percentage that way. BIA is really easy, really quick, and if you follow all the guidelines, it does a reasonable job. The problem is there's a lot of guidelines, which means there's a lot of assumptions that the test is making. And those assumptions are primarily because it's going to require a similar amount of water in the body and electrolytes in the body to the way the system was created and tested. All right, so if you become dehydrated from exercise or just being out in the heat, if you're hot and the fluid shifts from the inside of your body to the outside to your skin, if you eat a big meal, if you don't eat, if you don't drink, if you drink or eat too much, if you do any of these things, it's going to affect BIA and make it so that the values that you get are completely irrelevant. So if that happens, it's very, very easy to get really just crazy numbers. I've seen on these machines, somebody come in and have a body fat percentage of, say, 15%, then they exercise and they get back on the machine and it tells them their body fat percentage is like 33%. All right, so it's really, really easy to mess these machines up. And unfortunately, when they're just put out into fitness centers and people are allowed to use them at will, usually what they're going to do is they're going to exercise and check at the end of the workout, see how they did, and at that point in time the values they're going to get are completely bogus. So it does work, it does its job, but you have to know all the ins and outs of the pre-testing guidelines to make sure that you follow them appropriately. If you go too high or too low with your body fat percentage, it's a negative thing, so you're going to have negative health consequences for doing so. Again, too high was obesity, too low is usually when you start getting into issues. It may or may not be anorexia, bulimia. You can also end up with the female athlete triad. They're also starting to talk about a male athlete triad, which I'm not going to really go into here, but basically it's when your bone density and your immune system gets sort of overrun by your inability to maintain a proper amount of energy in the body, so calorie deficit. And so it's going to cause all kinds of issues. All three of these are going to cause issues, just like obesity causes issues. They're just different issues. So it's really useful to be able to calculate your optimal weight. If you know how much fat-free weight you have, so if you do say you're 10% body fat, and let's just make the numbers easy, say you're 200 pounds, that means you have 20 pounds of fat, and you have about 180 pounds of lean mass. So the fat-free mass would be the lean mass. So you would put the 180 here, and you divide that by 1 minus whatever your optimal body fat percentage that you determine is. So look through the normative charts and pick what you think makes sense for your sex, your age, and what basically your goals, what realistic goals you have. And so then you can put those numbers in, and you can calculate your optimal body weight from that. So it's really easy to do, and it just requires you to know some of the norms as well as what your body fat percentage is. Talking about losing weight, again, a lot of people are on diets because a lot of people are overweight and obese, and there's a lot of bad information out there. Now, I'm not a dietitian, so take some of what I'm saying with that in consideration, but the basics are the same, and most people in our field, the exercise sciences, know the basics, so you should too. So some of those basics are make sure that you have safe and effective weight loss. So that means no more than 1 to 2 pounds per week. If you're losing more than that, the person's probably not doing it in a safe way, and they're probably going to yo-yo, and so the weight's going to go right back up. So slow, steady weight loss is the key. Ultra low calorie diets. So this is just a list of kind of tips and information you should know. Ultra low calorie diets are bad. They do not help you lose weight long term. You might see a weight loss initially, but then your metabolism is going to drop to meet the level of your new intake, and basically you're starting all over again. You can't lose weight. You kind of plateau. All right, so you need to lower your calorie intake, yes, but not to the point where it's excessive. And excessive, typically people say for women, is less than 1,200 kcals per day. So anything less than that is a starvation diet. You shouldn't do it. For men, less than 1,800 kcals per day. And of course, there are some nuances to this. I'm giving you just general information here. All right, so you always hear the diets talking about, this type of carb, that type of fat. Really, the thing that matters most when it comes to weight loss is just calories in versus calories out. So how many calories you eat versus how many calories you burn through activities of daily living and exercise. So just make sure that you are able to count the calories, and you should be able to lose weight that way. Adherence to a diet is more important than the type of diet followed. So again, you always hear people talking about this diet or that diet, and this one's great because of this, this, and this, or that one's great because this and this. What matters is your ability to adhere to it. If there's some diet that causes crazy weight loss really fast, again, first of all, it's probably not healthy. It's probably not going to be maintained. And that maintained thing is what I'm talking about now. If you lose a ton of weight right off the bat, you're probably going to put it all right back on because you're doing it in some crazy diet where you can't maintain it for a lifetime. It's important to realize that, and we'll skip down here for a second, that what you are doing right now is going to determine your body fat percentage and your body weight status. So if you change that, your body weight status, your body fat percentage is going to change. But if you go right back to what you were doing, it's going to go right back to what you were doing. So this isn't about a short-term fix. It's not about losing the weight and then going back to normal. You need to pick something that you can do for the rest of your life. All right, so these crazy extreme diets are not something you can do for the rest of your life. It's probably not even healthy to do for the rest of your life. Pick something that you can do for the rest of your life. Do behavioral changes, not just a diet. So a behavioral change is something that you change about who you are and the way you behave and your actions. And once you do that and you stick to those behavioral changes, if they are healthy changes, hopefully you'll have a little bit of weight loss with those, and it'll be sustained weight loss, and that's the key. All right, so let's go back up to this real quick. Calories from food and beverages should be balanced with calories expended if you're trying to maintain weight. And then if you want to lose weight, gradually decrease your calories and also increase your physical activity. So if you just decrease calories, your metabolism is also going to go down. That physical activity is really important to make sure that your metabolism stays high or even elevates a little bit. It's going to keep you losing weight over time. So one or the other is great, but put them together, diet and exercise, that's where you're going to get the most weight loss and sustained weight loss. And then also, most people who are obese, they have a lot of weight to lose. If you have a lot of weight to lose, you're not going to be able to just make one goal, I'm going to lose 50 pounds and you're going to make it happen some manageable period of time. That's not the way it works. You're probably going to have to make 3-4 goals in order to get to your desired weight. So maybe the first goal is to lose 10 pounds and the second goal is to lose 5 pounds and the third goal can also be another 5 pounds. And you keep setting new goals so that you have that constant drive towards something, and you also get the reward of achieving a goal on a regular basis rather than having this big lofty goal that you're probably never going to get to because it's just too much, too intimidating, and it just makes it much harder from a mental perspective to keep on track. So it's important to know what your energy needs are, and so in order to do that, you should probably try to calculate at least an estimate of your resting energy expenditure. So resting energy expenditure is basically if you just sat around all day, how much energy you would burn through. And we all burn through most of our energy typically is burned through just resting energy expenditure. So we have some different formulas here. So for non-obese adults, so people who are normal weight or overweights, but not to the point of obesity, you should probably use these formulas up here. So we have the one for men and another one for women, and I'll let you read those on your own. Basically, though, you're going to be calculating kilocalories per day based on your weights, your height, and how old you are. If you're an obese individual or you're working with an obese client, these are probably better equations here. Again, there's one for men and one for women, and it is based on the same things: their weight in kilograms, their height in centimeters, and their age in years. All right, so these are going to be used to calculate resting energy expenditure. So let's say you do the formula and it tells you 1,300 calories. That means you need 1,300 calories to maintain your weight, to not gain or lose weight, if you aren't doing any exercise or any physical activity that day. So again, this is not taking into consideration your activity level. In order to do that, you need to multiply it by an activity factor. All right, so you take your resting energy expenditure and you multiply it by an activity factor, and that's how you're going to calculate how many calories you need to get in order to maintain your weight. If you want to lose, you just do a little less. If you want to gain, you just do a little bit more. All right, so for a sedentary person, the activity factor is 1.2. So you just multiply that 1,300 calories in the example I just mentioned by 1.2, and that'll give you the total energy expenditure for the day. And then again, you can plan your weight loss or weight gain or weight maintenance accordingly. For light activity, it's 1.375. For moderate activity, 1.55. Very active, 1.725, and for exceedingly active, so we're talking like athletes who exercise hours a day, 1.9. All right, so these are all just estimates. So the resting energy expenditure is an estimate. This total energy expenditure is also an estimate. So it's a good place to start and sort of see how it goes. So if you do these formulas and you have a reasonable plan, you cut your calories back at a reasonable amount, and you increase your physical activity at a reasonable amount, and let's say you don't lose weight, you just kind of maintain, then you know you probably need a little bit less than this, and you just kind of chip away at it as necessary. All right, but this is a really good starting point. So start with these formulas. If you need more calories, add more calories. If you need less calories, take away more calories. So it's, again, just a starting place. They're estimates. They do have some error to them. They're not going to work for everybody, but they'll work reasonably well for most people. So that was an overview of body fat, body composition assessment, and so the body fat percentage estimates for healthy individuals, and talking about weight loss a little bit there at the end. So if you have any questions, you can put those in the comment section below, and I'll try to get back to you. Otherwise, please come back and watch another video. Thanks.